helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Hattie Cheek. Dr. Shuler is back with us from Marshall Orthopedics at Cabell Huntington Hospital. Good to see you
Good to see you again.
Now, summer, it is a busy time for you guys. What's going on in the summer that it gets everybody brought into this office?
Well, I do orthopedic surgery, which is injuries to tendons, muscles, bones, and joints. So summertime, particularly in our area and climate, now we get to go out and do things.
Yeah.
So from getting your body back for that swimsuit weather, to playing and doing sports that maybe you haven't done before, to just recreational thing, yard work, there's lots of injuries that can happen that affects tendon, bone, muscles, and joints. So that's why our office is pretty busy time this time of year.
And I was even saying earlier, I was like, oh, the kids, you know, falling out of the tree. No, apparently adults are headed in there a lot more during the summertime,
We can all do things thanks to ATVs, cars, everything like that. So there's lots of summertime injuries.
Are you seeing a lot of sprains?
Exactly right. The most common joint to get sprained is the ankle. So to give you an idea, in the United States per year, 1.9 million ankle sprains happen a year. That's 25,000 a day. For when we
25,000 a day. When you
25,000
like
a day ankle sprains.
Oh,
it's amazing. So pretty much all of us have had that. One of the keys on treatment is to try to prevent the injury from happening, or if you have an injury, make sure you do the appropriate things to rehab on it. Now, for what we do in orthopedics, we think of ankle sprains almost like a traffic light, and let me explain what that is.
Okay.
Red light, green light, yellow light. Red light, some ankle sprains we get on a scale of 1 to 3, 3 being the worst. That's something unstable. That's one when you sprain, you say, heck, I did something really bad here, I can't walk.
Right, okay.
Those we do want to see and evaluate, maybe even get an x-ray picture to see if there's a fracture. There's ones in between. I'm sure that we've all maybe twisted ankles, stepped inappropriately, and said that, you know what, it just doesn't feel right. What should I do about that? Those are also something that's worth getting seen and checked out, because we can do different types of bracing and things to help out a person. Ankle sprains, little small twists, that's the one, the green light. A lot of times we can do those and you just sit for a little bit, get back in the game. I think that's happened to all of us.
Yeah, so do you think, should they take some time before they come see you? How long do you think?
Exactly right. Well, it depends on what the symptoms are. One of the key things to look for is after the injury happened, were you able to put weight back on the leg or not?
Okay.
If the answer is yes to that, well, that indicates maybe a less severe type of injury. If the answer is no, that's something worth getting checked out and seeing. For example, at Marshall Orthopedics, we have a walk-in clinic for any weekend warrior activity, or maybe children playing and all that. It'd be a great time to come in if there's an injury happen, just to get it seen and checked out to make sure it isn't something more severe.
And people are always worried on the weekends, oh, what do I do, where do I go? So versus, is it instead of going to the ER, they can head over to you?
Well, even to the ER urgent care centers like what we have at Cabell Huntington Hospital. So that anytime, 24 hours a day, we have something available to take care of these musculoskeletal injuries. And to let you know, out of all the people that present to, say, for example, an emergency department, 75% of those injuries are exactly what we're talking about. Injuries to muscles, tendon, bones, and joints.
And now I know that trampolines are a serious cause of injury. There are a lot of different activities that kids and adults do every single day, but you had mentioned prevention being really important. How do you prevent something like that?
Well, I think common sense and supervision is one thing. So let's go through some maybe big ticket items right now. Summertime happens now. We're going to take family vacations. People are more on the road. There's kids now maybe just first learning how to drive. One of the biggest injury mechanisms, believe it or not, the car. The car. So seat belts, car seat use, even putting a car seat in the back with a seat belt, 71% reduction of injuries in infants. So big items. Another thing, maybe you have a teen that's just learning how to drive. If there's 2 people in the car, 300% chance increased risk of a crash. If there's 3 people, 700% increased chance of a crash. So big ticket items right now. Even think about car safety. Now, things I'm thinking about are wearing helmets maybe for riding a bike, elbow pads, wrist guards, knee pads, things like that to help decrease injuries. And you mentioned even trampoline. Trampolines, even from American Academy of Pediatrics, they don't recommend that from even 1999 in your backyard. And even some homeowner policies don't even cover if you have it or cover injury. The things, if you do have a trampoline, if somebody in the audience has that, it's good to have one person on the mat. The way you think about that, 75% of injuries on trampolines happen when there's more than one person on the mat at the same time. You think putting the screen around it, and we've seen that, the little net around it to prevent you from falling off, that's not how those injuries happen most commonly. So supervision, one person on the mat, because otherwise you're creating a human pinball machine, and that increases the risk of injury.
All right, so good tips. One person on that trampoline, folks. If you guys need any more information, just head to our website, click on the Moms Everyday tab, and then make sure that you download our Moms Everyday app. I keep saying it, got a lot of good tips there. We'll be right back after the break for more Moms Everyday, so stick around with us.